To prepare an intravenous or IV infusion site, first verify the patient's identity according to facility policy.
And I need to ask your name and date of birth.
Curtis Peters, 11/12/75.
Comparing his name and one other identifier with the medication administration record, or his ID band. Then explain the procedure and determine his arm preference.
Raise your bed up.
After helping him into a seated or supine position and performing hand hygiene, organize the equipment on a clean, clutter-free surface. While setting up the supplies, check the IV solution to make sure the expiration date is not passed. Also, look at the color and clarity of the fluid and check the bag to make sure it has no leaks. Then prepare the IV bag and administration set. Remember to close the clamp and keep the tubing port and IV insertion spike sterile. Be sure to fill the tubing completely with solution and to remove any air bubbles. Use this time to explain the procedure to your patient. Now put on gloves, or do this later if you find it easier to locate a vein without gloves. In either case, distend and select a vein for IV access by applying a tourniquet around the arm above the antecubital fossa, or 4 to 6 inches above the proposed insertion site. To protect fragile skin or excess hair, place the tourniquet over a thin layer of clothing and don't apply it too tightly, or use a blood pressure cuff instead of a tourniquet. Check for a radial pulse, which should still be present. To better assess a vein's condition, place the extremity in a dependent position, or palpate it by pressing down with your finger. When you release the pressure, the vein should feel resilient, soft, and bouncy. If you have trouble identifying a site, promote venous distension. For example, stroke the extremity from distal to proximal areas below the proposed venipuncture site, or apply a warm washcloth to the extremity for several minutes. Then select a vein for vascular access. In adults, veins on the dorsal and ventral surfaces of the arms are preferred. These include the cephalic, basilic, median cubital, and metacarpal veins. Also, follow these vein selection guidelines. Always try to choose the most distal site on the non-dominant arm, a vein large enough for the IV device, and a site that won't interfere with activities of daily living or planned procedures. Try to avoid areas affected by pain, infection, wounds, cerebral vascular accident, paralysis, or mastectomy. Sites distal to previous venipunctures, veins in the antecubital fossa or inner wrist, sclerosed, hardened, or phlebotic veins, areas with infiltration, bruising, or venous valves, fragile dorsal veins in older patients, and any vein in an extremity with compromised circulation. Now carefully release the tourniquet. If ordered, apply a local anesthetic to the site. If you haven't already put on gloves, do that now. Then place the adapter end of the infusion tubing nearby. If needed, wash the insertion area with soap and water. Otherwise, continue by cleaning the insertion site with 3 swabs. With 1 swab, work vertically. Use swab 2 to clean horizontally. And move swab 3 in a spiral circling out. Then let the area dry completely. Don't touch it unless you use sterile technique. While the antiseptic is drying, prepare supplies for the insertion. Perform the venipuncture, as shown in the video skill performing venipuncture and initiating an infusion.